Hello, everyone. So I guess the live is starting right now. Thank you for joining our virtual dental shadow session. I want to remind you that in order to get your hours, you have to take a short quiz as long as you get a 3 out of 5, and you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, let's get started. We're very fortunate to have Dr. George today for our session. I'm handing the mic to you. Please feel free to start whenever you want.
Hello, everyone. Thank you so much for joining me today. And thank you to all the virtual dental shadowers team for doing this. I just got done telling them how awesome of a resource this is for pre-dental and dental students to have. Is the mic passed to me, or is somebody else supposed to be talking? Okay. How awesome of an opportunity this is for all pre-dental and dental students to be able to see what it's like to be in the profession. I was scrolling through the Instagram feed a couple of days ago and saw that they've had a good diverse group of specialties that have come to speak and taken over their Instagram. So definitely a really good resource for everybody to use as they go through their dental journey. I'm going to just briefly talk about myself and my journey into dentistry and how I got to be a dentist. And then I want to make this, I don't know how many people are on the YouTube, but I want to make this totally open for anybody to ask questions at the end. That's really what I'm here for. I'll talk a little bit about my journey, some tips and tricks for dental school that I learned along the way. And then I'll talk a little bit about a day in the life of me in my practice, the way I work, as well as a few cases that I've completed. So we'll go ahead and get started. I'm Dr. George. I practice in Amesbury, Massachusetts. It's a town about an hour and 40 minutes north of Boston. I went to school at Tufts University School of Dental Medicine. I've been practicing in Amesbury for about 2 years now, and I'm a general dentist. I attended undergrad in Worcester, Massachusetts at a school called WPI. Dentistry for me was something that I was thinking about for a very, very long time, dating back to my freshman year of high school. And it was just a thought for the majority of the time. And what really made me want to become a dentist was a few shadowing opportunities that I had along the way, as well as a trip that I got to take to Central America, where I helped out some dentists over there and got to help a community out that really had never seen a dentist before. And it was an awesome experience. And all of that combined really made me want to become a dentist. I took a lot of courses in undergrad that had nothing to do with dentistry. And I figured out probably around my sophomore year that I wanted to be a dentist. I attended Tufts. Can't speak highly enough of Tufts. It was an unbelievable school, great faculty, met so many awesome people. When you're in school, you'll see that dental school is everything you want it to be, how you make it. You can coast through, get done, not meet that many people, graduate, still be a dentist, or you can put everything you have into it, and it'll be an amazing experience, and you'll get so much more out of it than you maybe even think was possible. And we'll get a little bit into that as well. As a general dentist, it is what it sounds like. You can do just about anything. You need to be trained, and you need to have a lot of experience to do some of these things. What I stick to mostly is what you see on the screen here. I do a lot of cosmetic dentistry. Cosmetic dentistry is not a specialty. There are no cosmetic dental specialists out there. There are people who have taken a lot of extra training to become proficient in cosmetic dentistry, but it's very important to know that anyone can call themselves a cosmetic dentist, but it's extra training that you put in to we'll go over some of the cases too, so you can see what goes into really being a cosmetic dentist. I do a lot of CEREC, same day dentistry. What does that mean? That's digital dentistry. Same day crowns, no analog impressions. We take digital impressions and send them to the lab, or we can use them to make our crowns same day in the office with the mill. We have a 3D printer, all that fun stuff. You can ask me any questions you have about that too. I do a decent amount of clear aligners, so Invisalign or SureSmile for braces alternatives. And it's a really good way to supplement with cosmetic dentistry, or just move a few teeth that people don't like the way they're rotated. We'll talk a little bit more about that too. And I've recently started doing some sleep dentistry, and it's been very well taken in the office. What does that mean? That means people who have obstructive sleep apnea will come to the office, and we help to make appliances for them that allow air to come into their throat more, so that they can get better sleep. And it's life-changing stuff. It's very, very important for overall health. I won't talk too much about that today, but if you have any questions about that, it's a really, really new field of dentistry, and it's awesome. And we help so many people with more than just their teeth nowadays. So it's an exciting time to be a dentist. So we'll move forward here. This slide is talking about dental school. So when I went to WPI in Worcester, it was a very, very difficult school. Tons of, like most of you in college, you see time management, planning, finding time to study is almost the most important thing throughout this whole process. In dental school, what I say to people is that dental school for me, was not significantly harder than undergrad, but it was significantly more work. What does that mean? You need to be able to balance your time correctly. If you can't do that, you will not have a personal life, and you will not be able to enjoy your 4 years of dental school. So it's very, very important when you get to dental school. And I think this is the case for medical school as well. My brother's in medical school, and he does the same things that I do. So that I did. So what does that mean? What did I do every day? People thought I was a little crazy. What I would do is I would get up in the mornings or the night before, and I would pick up my planner. You have to buy a good planner. That's rule number one, buy a good planner. And I would write down by the hour exactly what I was going to do that day. That included dinners with family, dinners with friends, going out to get drinks, all of that stuff. That was all included in my planner by the hour. So from 7 to 8, gym, 8 to 9, lecture, whatever it may be. And every time I would finish something, I would give it a check. I would check it off. And that gave me satisfaction, knowing that I completed what I had planned to complete that day. At the beginning of the week, I'd have an overall list of what I needed to complete for that week. And I would make sure that all of those things were put into my checklist throughout the week so that I would finish it all by the end of the week. And if I didn't get something done one day, I was a little hard on myself. You don't have to be, but if I didn't get something done that day, I would highlight it and make sure that I moved it to the next day. That kept me really, really organized. And it made it so that when the weekends rolled around, if I wanted to go out with my friends or go get dinner or go watch a movie or something, I was able to do that because I knew that I got what I needed done for that week. That to me, looking back on dental school, was what separated me from some of my classmates who procrastinated and didn't plan the way that they should have planned. They weren't able to go to the social events. They weren't able to meet people. Some of you might be in these awesome cities. You want to live, when you're in these cities for 4 years, you want to be able to get the most out of it and see as much as you can. So that this advice on staying motivated and study tips was very, very important. The way I studied in dental school was also a little unorthodox. What I would do is I would go to the lectures, I would watch the live recordings, and I would write down absolutely everything from those two things. I would combine, I did both. For me, it helped being at the lectures, being there in person. For a lot of people, they just watch it online. That's fine. That's kind of where everything is moving towards anyways. But I would do that, and I would continuously add that to my planner. Say, okay, now from 10 to 11:30, you're going to watch this lecture and you're going to write down what you missed. Anyways, I think you guys get the point for study tips and staying motivated. Choosing specialties. This is something that you can ask 100 different dentists and different specialists, and they'll give you 100 different opinions. What I tell you as a pre-dental student or as a dental student is to keep an open mind. When I went into dental school, I was like everybody else. I was like, I want to be an orthodontist. That's what I wanted to do. I was like, I want to be an orthodontist. And that's fine. And I think it's really, really good to have an idea of what you like, because as a pre-dental student, it's very important to shadow and see the different kinds of specialties, not only for yourself, so you can see what their life is like, what it's like to be an orthodontist or an endodontist or a periodontist, but it's also very important to dental schools. So when you're applying to dental schools, they see that you have seen a wide range of dentistry. They want to make sure that you're in it for the right reasons, and they want to make sure that you know what the life entails, what it's like to be a dentist. And if you can talk about that and talk about your experiences in the interview, that's a very, very important thing. And a lot of interviews will ask you, do you know if you want to specialize? It's a you should tread very lightly on a question like that during an interview. I interviewed a lot of students in dental school as well. And I would tread very lightly with that question, because if you come out and say, yes, I want to be an orthodontist, and they look at you and you truly have no idea what it's like to be an orthodontist as a pre-dental student. I think the best way to approach a question like that is to say, orthodontics seems very, very interesting to me, but I really have an open mind and I can't wait to see what each specialty brings throughout my 4 years in dental school. And that's truly how you should approach it as a pre-dental student too, is keep an open mind. Just because a dad or a mom or a friend or someone's an orthodontist or an endodontist does not mean you have to do that. That being said, we all know that there's a certain set of specialties that you need to have a certain GPA and you need to have a certain class rank. So if you see yourself wanting to do that, I mean, you should always strive for the best. But if you see yourself wanting to do that, then set yourself up for success. That's the second bullet point there. Make sure that you keep that GPA up and your class rank up, and do your shadowing and volunteering in case you do want to do that specialty. And if you didn't set yourself up for success, you've now fallen behind because you don't have the class rank that you need to be an orthodontist, for example. The third point is, it seems almost obvious, but you're going to be doing this for the rest of your life. Don't choose something because of the money, because your dad did it or your mom did it. You're going to be doing this for the rest of your life. If you think that root canals are boring, don't be an endodontist, because that's what you're going to be doing for the rest of your life. If you think pulling teeth is gross, extracting teeth is gross, don't pull teeth the rest of your life. It's very simple. That's not to say that, like the next point, are you good at it? It's not to say you can't get better or you can't start to like something. But if you're truly interested in something, it's really, really important that you exhaust all of your options in dental school and actually see if you're good at it and it's something you're going to want to do for the rest of your life. And the last bullet point, I'm going to give an example of this. When I was in my second year of dental school, I went to a lecture that this big shot dentist in Boston was giving us. And there was 3 prosthodontic residents. So they were going to both be, or all 3 of them were going to be prosthodontists in the next year or two. And the big shot dentist from Boston looks up at them and says, he saw the doctor on their tag. So they weren't students, they were in residency. And he said, what do you guys do? And they go, oh, we're prosthodontic residents. And he goes, that's a dead specialty. That, to me, to hear it from someone, when I was in dental school and I heard that from somebody, it really turned me off to that specialty. I didn't want to do it. I was like, if that's a dead specialty, then why am I going to waste my time doing that? Basically, what I'm getting at is everybody has their own opinion on different specialties. And it's really important to put together your own opinion. That's not to say that there aren't certain specialties that are heading in different directions. That is true. Implant dentistry is becoming so big nowadays that different specialties we may see in the future start to place implants when they don't at this moment. So basically, prosthodontics is not a dead, now in my years of experience now, prosthodontics is not a dead specialty. A prosthodontist can charge more for a single crown than a general dentist can. It's not a dead specialty. And it all depends on where you practice. There's different areas where prosthodontists will be more successful than in other areas. So it's really, really important to put together your own opinion. Make sure you get your advice from somebody that you trust, somebody who's like you, who you could see being a mentor of yours, that you could see being like them. And maybe take that advice a little more to heart, because that really, nowadays, what I do in practice is I do prosthodontic dentistry is what I do all day. Why wouldn't I have thought about becoming a prosthodontist? I don't know, and I'm happy where I'm at now, but what I'm getting at is that person really turned me off to that specialty, all because of his opinion. So put together your own opinions. Choosing your specialty or no specialty is fine too. You'll see that general dentists do a ton of different dentistry, and it's fun. It's fun to be able to do different things every day. But put together your own opinion, exhaust your options, do a ton of research by yourself, and listen to people that you trust about these things, because dentistry is moving in different directions, but that's not to say that any specialty is dead. All right, let's go to the next slide. That was kind of my dental school blurb that I'm going to give you guys. And I want you guys to ask me a ton of questions at the end if you have any about dental school. I think that is more valuable than me just talking to you about what I experienced in dental school, because I can answer any questions you have about dental school, but I can't fit it all into all the slides. So we're going to move a little more into sort of what I like to call, I mean, it's a well-known thing, comprehensive dentistry. When I graduated school, I worked at a few different practices, and they were modeled a bit differently than the way that I practice dentistry now. It was a model of squeeze as many patients into the schedule as it makes sense to, as is possible. And that's a fine model for different areas of the country or of the world. But that's not really the way that I enjoyed practicing dentistry. And there's nothing wrong with practicing dentistry that way. It can be a very profitable way of practicing dentistry. And if you do dentistry well, and if you're a good dentist, it can be a good way of practicing. The way I like to practice is very comprehensively. What does that mean? Very, very thorough medical and dental histories for every new patient. New patient exam is as important of an appointment as any other appointment in your schedule for that day. I want you to imagine that most people do not like us. Most people do not like dentists. They come into you, and you now, this is really powerful. You have the opportunity to win somebody over at that new appointment for the rest of their lives. Think about that. Somebody that dislikes your profession as a whole, you have the opportunity to change their mind and win over a patient and their families and their friends for the rest of their life. How important of an appointment is that? That's an important appointment. So when I have a new patient in my schedule, and we've been getting a ton of new patients, when I get a new patient in my schedule, I prepare for that new patient before I even see them. I know their name, I know where they're from, I see their x-rays, I see their chief concerns, I see if they have any aesthetic issues, if they have any pain. I ask the questions, but I already know the answers to them, because I'm going into that appointment knowing I'm as prepared for that appointment as I would be if it was my first root canal in dental school. Okay? It's very easy to lose track of the big picture during these appointments, right? Somebody has their chief concern, and it's very, very important to address that chief concern. And I'll go through that briefly with you too. But you need to have an open mind with all of this. Somebody comes into you and they have one tooth that hurts. You need to address that first, but then also look at the rest of their mouth. The total mouth. You need to be able to look at it and say, okay, we need to come up with a comprehensive plan to either get this person stable, address their aesthetic concerns, or it could just be that they haven't been to the dentist in a while and they need to establish somewhere new and they don't have much going on at all. I'm going to go through three main scenarios at the bottom for a new patient exam, and how I approach them and how that sets the table for the rest of the type of dentistry that I do. So I wrote thorough medical and dental history. I review that in detail with them, including, it's just as in detail as it is in dental school. Don't let anybody tell you otherwise. When you're in dental school and you've got to go through all this medical history and do your medical consults with the medical team, that may seem like a lot, but that's when you graduate, there's no medical team. You're the medical team. So you need to be able to go through it and do a very thorough medical and dental history, and treat this patient as a whole. You're their doctor for that moment, okay? Patient's chief concern. I know in dental school, and there's nothing wrong with this, you have a hierarchy or a phasing of treatment where you got to deal with the perio first, and then you move to the restorative after that. If somebody's main concern is that they're in pain in the tooth, you got to take care of that tooth for them. Skip the perio. And a lot of instructors may not like to hear that, but that's the reality of it. Or you're going to lose the patient, or they're going to go somewhere else where they will get their problem taken care of. And then a consultation appointment is a very valuable tool for the patient and for us. So the consultation appointment is not your comprehensive new patient exam. The consultation appointment is a separate appointment. So in my practice, what we do, I work as an associate. I don't own the practice. In the practice that I work in, every new patient spends 1 hour with the hygienist and 1 hour with me, and they do not get their pro fee that day. And they are made well aware of that. So they spend an hour with hygiene, an hour with me. That's a long new patient appointment. But in that time, we treat them comprehensively, and every patient appreciates it, okay? So what happens is they'll do their entire perio workup with hygiene. Hygiene will approach me, give me an idea of the periodontal situation, give me an idea of sort of their chief concern. It's not chief complaint, it's chief concern. And from there, I'm able to spend my hour with that patient. Sometimes it doesn't take a full hour. You get a young patient who just moved to the area and wants to establish as a new patient in the practice and doesn't have anything going on, then that appointment might take 15, 20 minutes. It's very simple. The consultation appointment is a separate appointment that I use where if there's a lot going on or they have aesthetic concerns and they want to talk about it, it is not talked about in the new patient exam appointment. In that appointment, I gather my data and I tell the patient that. I say, okay, thank you so much for coming in. This is an appointment where I'm going to gather my information and you and I can sit down where I lay out all of my findings for you and I tell you what I think needs to be done to get you to a stable position, and you'll know the pricing and the timeline and the phasing of it all. And we can do this at a separate appointment outside of the chair. It'll take about 30 minutes. Does that sound good to you? No one has ever said no. And what that does for the patient is that they know that you are spending time outside of your work hours to review their case. And that's powerful for them. And they'll go and they'll say, no one has ever done that for me. No dentist has ever done that for me. What they do is, all right, you need an MO on 3, a DO on 4, you need a crown on this tooth, root canal on this tooth. It looks like the root canal is the most important. When do you want to get started? The patient's gonna be overwhelmed. They don't know what to do at that point. They just started this new practice. They spent 2 hours there, and all of a sudden now you're springing all this information on them. For me, the consultation appointment can go many different ways, but it's an appointment where you are able to remove them from the dental room. We sit them in a consult room with a table. We're face to face. There's no dental chair. I'm not wearing gloves. Now I'm wearing my mask, but we get the masks on, and we're sitting in there face to face, knee to knee, and we're talking as equals. And I'm just telling them what I see as their doctor. Okay. So let's go through these scenarios. So scenario number 1 is super simple, and you're gonna hear a lot of the same things. It's rehearsed. There's no wasted time. It's rehearsed. You go in there, and I've taken a lot of courses on treatment plan presentation, being able to talk to different types of patients, and it's a skill that you'll develop through dental school. You'll probably develop some bad habits in dental school, talking to patients, and that's okay. But when you graduate, I highly recommend, and if anybody at the end, you'll see I'll leave my email and you can message me on Instagram too. I have my Instagram. A lot of good courses that help with case presentation and talking to different kinds of patients and different words you should be using. But I'll go through a little bit of it now. So scenario number 1, this is the patient who's just looking for a new dentist in the area. They just moved to the area. I'll walk into the room. Again, I've reviewed everything. I know most of the answers to these questions that I'm going to ask. I walk in. Hi, I'm Dr. George. It's nice to meet you. And they introduce themselves. And I say, what brings you in today? And they tell me their chief concern at that point. And from there, I'll say, okay, that sounds good. Do you have any aesthetic concerns with your teeth at all? Do you dislike anything about their appearance or your smile? I ask that question to every single patient, every single new patient, before I look at the x-rays and before I look in their mouth. If you forget to ask the question, do not ask it after you look in their mouth, because that is not a good thing to do, because they are going to think that you saw something and you're judging them. So do not do that. It's a question that you ask the moment after you ask what brings them in. And no one has ever said anything because I haven't looked in their mouth yet. So this is a general question I ask. Do you have any aesthetic concerns with your teeth? Anything that bothers you about the appearance of your smile? And a lot of people will say no. Most people will say no. Or they could be a little whiter, or I got a little crowding on my bottom teeth. I didn't wear my retainer, and stuff like that. That's what scenario 1 will say. I'm looking for a new dentist. They'll say, no, I just kind of moved to the area, and my wife and I are looking for a new dentist, and we heard you guys were a nice new office, and we'd love to get established here. I say, great. Give me a moment here. I'm going to look over all of your x-rays that you guys took before I came in here, and you can follow along up on the screen. We have a screen right in front of the patient where they can follow along with what I'm doing behind them. I remember as a kid, I hated when the dentist would go behind me with his assistant and would start talking. I had no idea what they were talking about. And it made me nervous because they would talk to them. I never talk to my assistant when I'm looking at the x-rays. I have a piece of paper in front of me and I write down my findings from the x-rays for scenario number 1 here, okay? So I'll write down 4MO, 29DO. I'll write down that stuff. They need a filling on this, filling on that. I don't say anything to the patient or the assistant. I review all the x-rays. They're following along with me up on the screen. Then I say, okay, let me take a look in your mouth. I lay them back, take a look, and then I set them up. So this is for scenario number 1, somebody who's looking for a new dentist. I set them up, we take a look. I pull up the x-rays up on the screen. I have their intraoral photos, which is a very powerful tool, intraoral photos. People haven't seen the occlusal of number 18 in their mouth. No one looks in the mirror at the top of a tooth that zoomed in. It's a very powerful tool to have because you can see decay on teeth with an intraoral camera. So they're looking for a new dentist patient and maybe they have nothing wrong with them. And I say, everything looks great. You're doing a really, really good job. Keep it up. We're going to keep an eye on 1 or 2 of these teeth, but we're good for now. Everything looks good. Or it could be they need a couple of fillings or a crown. And I explain to them why, using the x-rays and the photos. This is not for somebody who needs a lot of work. This is for somebody who needs very little work or none. I'll explain and I'll tell them why they need a crown. Mrs. So-and-so, if you look at this amalgam here, this is an old silver filling, and I have no problem with silver fillings, but when they go, they can really go and they can take the tooth with it. And I'll show you why. Here's the intraoral photo. Do you see these little micro fractures that are coming off of the amalgam? This is me getting a little more, diving into a little more, but you show it to them and you say, this is where the tooth is starting to break down in this area, rather than me watching this and you coming into me and saying, I broke my tooth and then half the tooth is broken off on these fracture lines. Why don't we be a little more proactive and get something that's going to last you a little longer? Most people don't say no to that. Most people are in agreement that putting porcelain on that tooth is probably a better idea than leaving that amalgam there that's gonna break eventually. The point I'm getting at is that you can explain to them why they need certain treatment, and you can do this in dental school too. I mean, there's no reason not to do this in dental school too. You explain to them why they need the treatment. And I remember when I needed fillings, I had no idea why. My doctor would tell his assistant, and he'd leave the room, and then I'd be at the front desk scheduling something that I have no idea what I was getting done. So it's really, really important to educate your patients. Scenario number 2, aesthetic concerns. We have a lot of people come into the practice looking for veneers or crowns or Invisalign or whitening even, or bonding, composites on their front teeth. And they don't like their smile. And they'll make that known when I ask that question, the same question I ask every patient. Do you have any aesthetic concerns with your teeth? If they say yes, I still go through the exam the exact same way. And then I say, do you mind if I take some photos today of your teeth and your smile and your face? And I will sit down and I'll put together a smile design for you so that you can see what you would look like with different teeth in the front. Do you mind if I do that for you today? And I can bring you back for a consult for 30 minutes and we can discuss this face to face so we can know, we can both be on the same page, and I'll give you some options. Nobody says no to that. So you bring them back in, you discuss the treatment, and we'll go into that a little more in the following slides. And scenario number 3 is somebody who hasn't been to the dentist in many years and they have a lot of active decay and tons of work that needs to be done. Again, approach the same way. I still ask the aesthetic concerns question. If they have aesthetic concerns, I make it known in the consult appointment that those will be addressed once we get a hold of the issues at hand. I'll bring them back in for a consult and I'll phase treatment. Phasing treatment is very, very important. I show patients exactly what I see in my consult appointments, and that could be $20,000, $30,000 of dental work over their lifetime. But I think it's important for the patient to know what is in their mouth, what's going on, and we'll chip away at it is what I tell them. I'll tell you what's most important to be done, and then we'll do it little by little to get you to a stable position. And eventually, my goal is to get you in here every 4 to 6 months and get your cleanings done, and then that's it. That's all we want. We want to get you to a stable position. If you can phase treatment for some of these patients who are very scared to be in your chair, because scenario number 3 is a scared patient. Is somebody who hasn't been to the dentist in a very long time for whatever reason, whether it was financial constraints, whether it was something that happened in their life that they weren't in the right mindset to go to a dentist, or they're just terrified of you. There are people who are terrified of us. So scenario number 3 is one that I see a decent amount, which every dentist will see a decent amount. And it's important to be able to approach it in a stepwise fashion so you don't overwhelm the patient with the amount of work that needs to be done, okay? And we'll move forward. So I'm gonna go over some cases and I will touch on some of the, by the way, I have written and verbal consent from all these patients to show their faces, okay? So you don't have to worry about that. And I'll go through a little bit of each one of these patients when they came into me, what their concerns were and how I addressed it through the first appointment all the way to the end of treatment, okay? So this gentleman came in, he told me he didn't have that space in between his two front teeth 18 months ago. He's retired, he golfs a lot, and he finally wants to have a nice smile. So that when we take these masks off, he'll be able to show off his teeth again. He said he brought a picture of himself in when he was 20 years old and said, this is what my teeth used to look like. They don't look like that anymore, and I want them to look like that. So I sat down with him. I went through he was scenario number 2 for me. He was aesthetic concerns. He wanted to fix his front teeth. And sometimes you need to educate patients about it won't just be the front 2 teeth. It may be more teeth that we have to incorporate. And that's all part of the consult appointment. So I took a ton of photos of him and I sat down on my own time and put together a smile design for him. What does that mean? A smile design is using a couple of photos, I'm able to overlay teeth onto his current teeth at the right proportions to his face. There's a ton of different rules and different types of proportions that you use in dentistry to match lengths of central incisors to laterals to canines, to the bottom teeth, and also to the person's face, facial aesthetics. So I do that on my own time. And then I bring the patient back in and I show him some of the cases that I've completed, as well as his smile design and how we're gonna attack that, how we're gonna do that. I gave him a few options. It wasn't just 10 porcelain veneers and crowns, which is what we did. I gave him the option. I even gave him the option of replacing his 2 front teeth, but I told him, if we only replace these 2 front teeth, they're gonna be bulky like they are right now. You need to know that. He didn't want that. He wanted to finally have the nice smile that he deserves. So I went through his medical history, no significant medical history. He's missing 25 and 31, and he has some mild to moderate wear on his teeth. So he's not clenching and grinding at night, and he doesn't have a different chewing pattern, we could say. Okay, so I go through a full TMJ exam. I ask them a ton of questions about their day-to-day habits with their teeth, if they've seen any changes over the past couple of years. Were your teeth always this color? It's an endless list of questions that I ask because we want to be prepared for what the reason that they're there for. You want to make sure that you don't overpromise, right? You want to make sure that you can get the results that you want and what the patient wants. Okay. So the treatment that we did after consult was 10 porcelain veneers and crowns. So obviously those front 2 teeth are crowned. Those are not his natural teeth. And because of his traumatic bite that he had, those 2 teeth were hitting so hard on his bottom teeth that they started to separate over 18 months. So the goal I had was to fix that for him and to give him a better smile. So this is how he presented, right? You can see how bulky these front 2 crowns are in comparison to the rest of his teeth. He's missing one of his incisors here because they got rid of it for Invisalign to make space for that. And he said the Invisalign did not end well. So Invisalign was not an option for him. He was so unhappy with Invisalign that I wasn't going to touch that. I wasn't going to do any more Invisalign. So we moved forward. Here's the smile design that I was talking to you about. On the left here, this is an app that I use, and I'm able to design the patient's smile using their face and the correct proportions. So you can see the heights and width of his central incisors. And we use that, not to get too technical here, we use there's the red proportion, the true proportion, the different types of dental terminology that you use and dental proportions that you use to help put together the proper proportion smile for the patient. These are the patient's temporary provisional smiles that we do, right? So the process is the patient comes in, I take the photos, I take impressions, digital or regular. I send them to the lab with this smile design. This smile design, the lab uses to make a wax up. That's the patient's teeth in wax. Using that wax up, I'm able to make this provisional, I call it a smile test drive. There's a lot of dentists out there that call it that, it's not just me. And these temporaries is what the patient is in for about 3 weeks. So they get to test this out. They tell me, I don't like this corner here. I don't like, I think this is chipped right here, but I don't like the length of this canine in comparison to this canine. I feel like I'm hitting too hard on one side. We really dial everything in for the patient during this test drive, right? And then after that, we take an impression of the provisionals, the test drive smile, send it to the lab with impressions of the actual teeth, and using my lengthy instructions that I give to the lab, they put together the final crowns and veneers. So here is where he started, and those are his final veneers the moment that we put them in that day. Night and day difference for this patient. You'll see, this is I'll go to this slide first. This is his before and after here. So completely different. He looks younger, he's happy. He invited me to come golfing with him. He golfs during the day though, so I have to work, so I couldn't go. But exceeded his expectations. He's thrilled. And we have a patient now for life, and he's telling all of his friends about it too. So it's great. This previous slide here, I wanted to talk quickly about. This is a very close-up photo that I took of the ceramic work that the lab did. In dental school, you guys will not use these kinds of labs. The dental schools do not want to pay for these kinds of labs, and that's fine. I understand it. But once you graduate, it's very, very important. These people are paying big money for these cases, right? They're paying a lot of money to get this stuff done. Find a really good lab, a really, really good lab. This one was done by Arrowhead Dental Lab in Utah. I have a ceramist there. Her name is Ada. She's incredible. She does really, really good work. It makes the teeth look so natural. And we pay for it. It's a lot of money for the dentist too, but it's something that if you're going to be doing these kinds of cases, don't cheap out on the ceramic work, right? Make it good, make it really good for the patients. Okay. Again, before and after. So this is where I want to take a step back here. And we live in a world now where Instagram and Facebook are king, right? That's where people go to find their dentist nowadays. I started an Instagram. I only have like 400 something followers. It's not a big deal. I don't have that many. I like to post my work on it. And I think that people have come to me for Invisalign mostly because of what they saw on my Instagram. And I think it's a very valuable tool for dentists to have, to educate patients and to show patients work. But I also want you guys to know that I can't speak for everybody. There's dentists out there that are only doing these kinds of cases all day. Prosthodontists, dentists, whoever it may be, doing these kinds of cases all day. The great majority of these dentists that you see posting their work and acting like they're doing all veneers all day are not just doing veneers all day. As a dentist, you are doing fillings, you are doing exams, you are doing bread and butter dentistry all day too. That's the great majority of it too. So I think it's very important to not get so caught up in the cosmetic work. It's very fun. I love doing it. I get so excited to do it. You change people's lives, but you need to get very proficient in dental school at doing your bread and butter dentistry, because that's what you're going to be doing the majority of your life. Unless, I hope you all become the next Dr. Appa. That'd be amazing. But if you don't, then you're going to be doing, I do a good amount of these cases. I enjoy it, and I hope to do more and more and more as my career progresses. I'm a fairly new dentist. I hope to do more and more and more, but you have to realize too that these dentists, the majority of them are doing single crowns, fillings, and that's where most of their production comes from. So it's really important to get good at that in dental school. Buy a camera, buy a nice camera, and take photos of all of your work. And then sit down after you're done and critique it and look at it and say, I could have dropped that margin a little more, or that margin's a little rough. I could have fixed that. Or I could have added a little more anatomy into that composite. I know I'm being really picky here, but you can't see your work. You may think that something looked great, and then you see it again in 6 months and you're like, I could have done that a little better. Imagine having that at your fingertips the moment after the appointment, so you know during your next appointment, I could have done this little thing a tiny bit differently. It's very important to photograph your work. And don't use your iPhone. Everyone tells you can use your iPhone. Don't use your iPhone. The iPhone is just going to make it look like it's blurry and it's not good. Invest the money, maybe not in dental school when you graduate. Buy yourself a nice Canon or Nikon camera and take some good photos for yourself and for your patients, okay? Number two, this is a case I did a little earlier on. And This patient's concern is that she just wanted nicer teeth. You guys are gonna laugh. This is my aunt. She's probably on this call right now. I told her that I was presenting her case, and she really wanted to be here. So she's probably on the YouTube stream right now. So she told me back when I was in my first year of dental school, I remember it. She said that she wanted, when I became a dentist, she wanted to fix her teeth. So when I became a dentist, I wanted to fix her teeth. So she felt like her teeth were getting a little worn down. They weren't the color that she wanted. We took a very thorough medical and dental history on her. You can see that she needs to pre-medicate before every appointment. She has a stent placed for a heart attack. So she pre-medicated 1 hour before every appointment that we did. She's missing tooth number 30, and she has mild to moderate wear. We replaced her defective amalgam on 19 prior to doing this full arch rehab for her. So we ended up doing 20 Emax Prime. There's zirconia veneers and crowns on her teeth here, okay? Same type of process with her as it was with everybody else. This is scenario number 2 again, all right? This is how she presented to me. You may say, why did you do 20? 20 is a lot. 20 is a lot of teeth. Why didn't you just do the front 8 or the front 10 like you did in the last guy? Well, look back here. If you zoom into this, microfracture, microfracture, microfracture. I can't see this on the side here. On the bottom right here, microfracture, microfracture. This crown is breaking down, microfracture, microfracture. Before you know it, if I do the front 10, she's gonna have a couple of teeth that are gonna need crowns in a couple of years. Why not do this all to make this, this is comprehensive dentistry. This is what I wanted to be doing. This is what you're trained to do. We needed to replace these with crowns anyways. Why not incorporate it all together? On the bottom, for occlusal reasons, for her occlusion, we included her lower 6 teeth as well. So that top 14, bottom 6, that makes 20 teeth, okay? So this is where the initial presentation to me. So here's the final, right? And if you guys have more questions about how I got to this point, I know that I'm presenting dental cases now to dental students and pre-dental students. So it can be a little over some of your heads, and that's fine. Ask me questions. No question's a dumb question. So this was immediately after the veneers went in and the crowns went in. These are zirconia. The previous ones were porcelain. And here is my aunt. Beautiful. So she's very, very happy. There's always things that I would change. There's always things that you're going to look back and say, I wish I did this differently. And if you ever think that that's not the case, you're wrong and you're not critiquing yourself enough, because it's very, very important to look at your work and be overly critical about it, because that's when you start to make yourself an incredible cosmetic dentist, somebody that people seek out for their cosmetic work because of how nitpicky you are, right? That's my presentation. That's my Instagram down there. That's my email. You guys can feel free to message me on any one of those or follow me if you want to. I post some cases on there once in a while, so I enjoy doing it. And like I told you, I do bread and butter dentistry. So do most dentists. Bread and butter dentistry, single crowns, fillings. It's not just the cosmetic work. So get good at that in school and understand the concepts. Even dentures. Dental students hate dentures, hate doing dentures. Denture concepts are applied. My aunt's case here, denture concepts, the whole thing. You're redoing an entire arch. You're prepping 14 teeth. You need to apply somewhat of the denture concepts that you learn, occlusal schemes, all that kind of stuff that you learn in dental school, in your workup for it. Okay, so get good at what you do. Be the best dentist you can possibly be, and everything else will fall into place. Okay. That's it for me. I hope that you guys enjoyed it. I really hope that you guys have some questions for me too. I don't even know how many people are watching, but for however many there are, please fire away with all questions that you may have.
Thank you so much, Dr. George. We have some questions from the live chat. The first question is, can you expand a bit more on what sleep dentistry is?
Sure. So as a dentist and I think any dental specialty, you cannot diagnose sleep apnea. What is sleep apnea? Sleep apnea is obstructive sleep apnea is the inability for, in a nutshell, there's a bunch of different apnea, hypopnea indexes that it's graded. Sleep doctors interpret sleep tests. And essentially what it is the patient is not getting enough. There's something obstructing their airflow into their mouth and then into their body, so that they don't get enough oxygen to their brain, and it ends up causing a lot of overall health issues. That's really it in a big nutshell. Sleep apnea is a very, very complex part of medicine. And based on sleep testing results, what we do in the office is we send patients home with at-home sleep tests. So I give them a Vimeo video on how to place the leads onto their face and onto their chest, onto their stomachs, and it interprets their sleep throughout the night. How many times do they have obstructed airflow? How often are they snoring? And we send those results to their sleep doctor. So we work with some sleep physicians in the area, and we also work with some sleep physicians through the tests that I administer. And that doctor will diagnose whether they have mild, moderate, severe central sleep apnea or nothing, or they're fine. And based on those results, as a dentist, you are able to make them appliances that help treat that sleep apnea. What does that mean? So a lot of times, if they have mild to moderate sleep apnea, they get a CPAP. I'm sure you guys have heard of the CPAP. The CPAP is a device that helps patients sleep. It's big and bulky, and it works really, really well. It's the gold standard. It will always be the gold standard for now. And it helps to get air into their body at a better rate. We don't do CPAPs. What we do is oral sleep appliances. And what does that mean? Rather than using a CPAP, now research shows that with sleep appliances made by your dentist, you can treat mild to moderate sleep apnea. We help to push the jaw forward with these appliances and allow the obstruction of your airway to be relieved and opened by moving your mandible forward. That way more air gets in. Once I make one of these sleep appliances, I bring them back in and we take another sleep test to make sure the sleep appliance is working well. And I work very closely with the sleep doctor to make sure that these are the types of results that the sleep doctor wants. Because if it does not provide the same relief as a CPAP, or it does not provide the relief that is needed to treat sleep apnea, then it's not working. So that's kind of in a nutshell. We make the appliances, but we need to have a general knowledge of what sleep apnea is and be able to work with some of these sleep physicians. That's what sleep dentistry is. I hope that answers the question.
Thank you. Someone asked, can you become a specialist and still do other procedures if you wanted?
Good question. Prosthodontists, a lot of them run general dental practices. So they'll become a prosthodontist, they'll go to extra school, and they will become very, very versed in prosthodontic dentistry, full mouth reconstructions, cosmetic work, that kind of stuff. And then they will still run a general dental practice. So they'll still continue to do restorative dentistry, crowns, fillings. They'll have hygienists in their offices. The great majority of other specialists do not do other work. If you're an orthodontist, you are doing orthodontia. If you are an endodontist, you are doing endodontic work, root canals, apicoectomies, that kind of stuff. To tell you the truth, I don't know the rule about whether or not you can or cannot. I don't think you can, but you can always go. I mean, I can't imagine you can always go back and just practice general dentistry. You have your degree. But I don't know many people who have done that. I would have to look that up for you if there's an exact rule about it, but it's probably frowned upon, to tell you the truth.
Thank you. The next question is, what is the difference between comprehensive appointment and consultation?
Sure. So I treat them as two separate appointments. So not everybody gets a consultation. A consultation is something that I do, and a lot of people call it the diagnosis appointment, right? Some people think the word consultation has a negative connotation, like you're coming in for a consultation, this can't be good, right? So what I treat it as is if there is a lot of work that I find that needs to be done during the comprehensive new patient exam, rather than overload the patient with a ton of information about what's going on, or somebody who wants cosmetic work and overload them with the entire process, like I kind of did with you guys, overload them with the entire process of how you get from point A to point B. I I take photos and I will use the x-rays and the medical and dental history, and I'll sit down on my own time after the comprehensive new patient exam, and I will put together the work that needs to be done for the consultation appointment. So I'll bring them in for a second separate appointment, 30 minutes or an hour, and I'll sit down with that patient in a separate room, and we will go over treatment that way, rather than having them laying back and I'm staring over them with the mask and my loupes, and it's not good. You want to bring them back in to discuss this treatment so that they're on the same page as you. And I always say that at the end. Can I bring you back in so that we can discuss the work that I find from this comprehensive new patient exam, so that you and I can be on the same page? Does that sound good? Find me somebody who will say no to that. Right? Everybody wants to be on the same page as their dentist, because nobody has ever been on the same page as their dentist. The amount of people that would come in when I was doing my rotations in dental school and externships, I would ask every patient, do you know what you're here for? And a lot of them, half of them, I would say no. They had no idea what they were there for, and they weren't going to ask. They were just going to let it happen. So to me, that's terrifying. And I want to be able to make sure that every single time a patient comes in, they know what it's for, they know what they're going to owe, and they know the comprehensive grand scheme of all the treatment that's going to be done on them. Okay. And it doesn't mean it all has to be done right away. We phase it, right?
Someone asked, can you elaborate on what you mean by bad habits in dental school when talking to patients?
You guys have, I don't know, at Tufts, it was 3 hours for the new patient exam, 3 hours for the comprehensive exam, 3 hours for the prophy, and then you could start doing dental work. I think that maybe bad habits, it's not bad habits. It's just that when you get out to the real world, you're going to notice that you need to be able to talk to patients a little differently than maybe you're taught to talk to them like in dental school. Sitting down with printing out a treatment plan and going around tooth by tooth sometimes is not the right thing to do. You need to be able to discuss with them, all right, this area, we need to do this kind of stuff. And then you inform them, they have it in front of them, what needs to be done, how many teeth need to have it done. But sometimes going through tooth by tooth is overwhelming for the patient. Sometimes you have so much in your head about an exam coming up or other things that are going on in dental school that it's not necessarily a bad habit that you have, but seeing that patient may not be, you might not be in the right mindset at that time. You need to realize that when you're in the real world, the patient is the only thing that matters. So bad habits may not be the right word. It's just that you're going to have to adapt depending on where you work and the type of people that you're working with after dental school. And that's not going to happen just by seeing patients. You're going to have to invest. I have invested a lot of money after dental school into my education. You're going to have to invest a lot of money in clinical CE, as well as being able to present treatment to people, because you can be the best dentist in the world. If you can't explain to people what needs to be done and how to do it, you're not going to do the dentistry. So it's very important. And I'm talking like I've done tons and tons of work. I've been out of school for 2 years. I haven't. I've just seen the progression of different dentists and the people who invested in themselves early on and went to a lot of CE, and the people who didn't. And I think it's very important to realize that aside from just becoming a very, very good clinical dentist, it's important to be able to talk to patients in a certain way so that they can understand you and also do the work, right?
Right. And let's do last two questions. Mm-hmm. As an interviewer for dental students, what was something that you found interesting from interviewee?
Good question. Something I found interesting. Can you ask a question back to the person? Are you able to do that or no?
Not now, okay. But
well, I'm trying to figure out what they mean by interesting. So I'll talk about when I interviewed 2 different people. Be truthful in your interview, right? Everybody can tell when you're not being truthful. That includes, I had a couple of people who had gotten in trouble in college for drinking. for example. And it was on their record, and I saw it before I went into the interview. And obviously you have to address it. Own up to that. I think that's very, very important. Own up to it and talk to me about how you got better as a person because of that experience and what you've done to change. I think it's very important to be truthful about that. Don't try and defend yourself. You got in trouble. It is what it is. Move on. Another interesting thing that I may see in interviews is people pretending like they know more than they actually do. As a pre-dental student, you don't know much about dentistry at all. So be very, very humble in your interviews. Be eager to learn. Be willing to adapt. It's very, very important that you go into those interviews and show the interviewer that you're somebody who is excited about dentistry, who's excited to go to dental school, and who's willing to learn. If you walk in there acting like you know exactly what you're talking about and you want to be this specialist because of this reason, there's nothing else out there. To me, that's one of the biggest no-nos in an interview, and I probably wouldn't want to be around that person. Imagine yourself. I know that a lot of people will say you're also interviewing the school. And that's true. You don't want to go somewhere that you don't see yourself fitting into. But at the same time, you need to be somebody that these people could see themselves in school with for 4 years. So be humble. You don't want to be that kind of person that's, what's the term, a gunner. You don't want to be a gunner. You don't want to be that person that will, at no cost, get that good grade or whatever it may be, right? You want to be a relatable person, a humble person, and somebody who's just willing to learn and go through the process and get the most out of it, right? Just be yourself in the interviews. If you're not yourself and then you go to the dental school, I know it sounds so cliche, but if you're not yourself and then you go to that dental school and people aren't like you, you're not going to have a very good 4 years. And believe me, I interviewed at many different dental schools, and I got into a couple and there was no chance I was going there. I would rather reapply because I did not see myself being and enjoying that area and those people for 4 years. So.
Someone asked, why did you choose zirconia instead of porcelain for case 2?
Good question. I do 98% porcelain. Very rarely will I do zirconia. In this situation, her posterior teeth, her back teeth, had a lot of wear on them. She had worn down into the dentin. She had those microfractures we were talking about on her posterior teeth. And I thought that I actually did gold on her second molars. I forgot to write that. I'm sorry. I put 20 zirconia. It was 18 zirconia and 2 gold. It was a more long-term option for her because zirconia is a stronger material than Emax porcelain. And with the recent advances in zirconia, the way that they stain and glaze it now, in the first case you saw, that was Emax. That's all porcelain. That's an all ceramic lithium disilicate crown. What they do with that is they cut it back. So they'll layer the crown and they'll cut it back and they'll add that translucency that you see onto the edges. With zirconia, you can't do that. Zirconia is milled, but it's also stronger than Emax, the porcelain crown. But with the ways that they are able to now stain and glaze zirconia, you can get very, very nice aesthetic results with it. And I thought for her, it was a better option for long term, for longevity of those teeth, so that she doesn't wear them down or start breaking grounds later on in life.
Thank you so much. That was a very informative presentation, Dr. George.
Thank you.
Unfortunately, this is all the time we have for today's session. And we just want to tell the viewers that the quiz will be our link tree in a second. So please fill out the quiz and you will get your hours locked in if you get 3 out of 5 questions right. Thank you so much.
Yeah, guys, thank you for having me.